The most important thing that a provider can do in the first session with a post-traumatic stress disorder patient is establish trust. Patients with post-traumatic stress disorder have had their worldview shaken. They don't know who they can trust. They don't know what they can trust. And often they come in concerned that they're going to have an experience in which they're going to be embarrassed or shamed. They may be concerned that the provider is going to see them as weak. They may have even experienced care providers who haven't seemed to have responded in helpful ways. So the most important thing to achieve in the first session with a post-traumatic stress disorder is establishing trust. It is not unusual for service members with post-traumatic stress disorder to feel the behavioral health provider out for 3, 4, 5 sessions before they'll say, "Hey doc, let me tell you what's really going on." The other important thing to do is to remember that you're not just establishing trust with the patient. You're establishing trust with the patient support network, whether they're in the room with you or not. So you better know what you're doing. You better know what you're doing as a provider, because if you don't know what you're doing, they're not going to feel confidence in you. They don't feel confidence in themselves. Why are they going to trust you with your emotional safety? So providers need to establish trust, and they need to establish trust by demonstrating that they know what they're doing, and they need to know what they're doing by studying the evidence-based practices.